HealingYourself.Life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions.
Go into my slides now, or
sure, that'd be great. That would be great.
Yeah. I can enlarge it here. There. Now this is the. Could you see that?
Yeah,
now?
That was your arm, huh?
Yeah, that's my arm, the right arm.
Okay.
I was cleaning my lake property, and I got a bite. This is within less than 24 hours.
Yes.
This is the perfect target syndrome.
Yes.
This is the tick, Ixodes pacificum tick in British Columbia.
So you actually had you found that the physical tick was still there. And the target, same thing, yep.
Yeah, okay.
And what I did to treat it, I used one method. I used cannabidiol paste. I put it right on the rash after the tick was taken out. And within 2 days, the rash was gone.
Wow, okay.
But I wasn't absolutely sure that the penetration of the CBD into the skin would be sufficient to kill everything.
Right.
So I took amoxicillin as well.
Okay.
Just to be doubly sure.
How long a course of treatment did you stay on the amoxicillin?
4 weeks.
4 weeks, opposed to the 10 days,
Okay. Yeah, and I know they say 2 capsules is all you need.
Yeah, but no.
But okay, what it'll do, the 2 capsules will kill the spirochete on the surface like here. But the tick, not just injecting spirochetes, is injecting the survival forms. The survival forms take a longer period of time to mature and become spirochetes, and therefore the antibiotic is needed to kill it as it matures. And that's why the 4 weeks is a minimum amount of time.
So you're describing the life cycle of the
survival form.
Lyme disease survival forms. So in other words, it injects these little cysts, which are these hard-to-kill capsules of it, and when they finally erupt open and turn back into the mature spirochetes,
That's right.
Okay.
The antibiotic is already in the serum. It'll kill them as they mature, and most of them are gone in 1 month.
Okay.
Now here, my partners did a study on the live spirochetes, and it shows you the corkscrew form, and this is in BSK, Balfour Stoner Kelly fluid, and this shows you the spirochete in motion going one way.
Yeah.
And they're very adept, and they have 138 genes, so they're highly intelligent insect.
Whoa.
And bacteria. Spirochete. Yeah, spirochete. And here it goes backwards and forwards by completely turning their coat right around. Yeah. And in a fluid solution, it becomes into clusters like this. And you can see these as foreign floaters in the eyes. If you had Lyme disease, you get these floaters. You wouldn't be able to see a single spirochete like that. But when you see it like clusters, then you get foreign body reactions in the fluid in the eye.
Okay.
That's what my theory is, that's what causes the floaters. And for some reason, when they get into this situation of being threatened either by temperature, toxicity, chemicals, antibiotics, they go into these jelly-like forms. These are the biofilms that form on the spirochete.
Okay.
And that is the protective agent for the spirochete. And when that happens, the spirochete survives in the body and causes chronic Lyme disease. Okay? And this is, again, my own theory as to why many people require antibiotics for such a long period of time.
Right.
And we thought the biofilm only occurred in the fluid, but Dr. Eva Sappi, who is my associate who is doing research with us, she found that there was live, not particles, but the biofilm built up in the body, protected the body from antibiotics, antibodies, and white blood cells.
Okay.
So that's why the biofilm has to be really considered to be removed before you get a proper treatment.
Right. Yeah.
That's one of the things we keep hearing is that people think that they're they're cured, but then it keeps coming back, and it's not so much that
That's right.
came back as it
Yeah,
never really
It
left.
never left. Yes, it never left.
Either the biofilm or the survival forms that are not treated properly. Yeah. This came to me from the MS Association. Canada has the highest MS in the world, 340 per 100,000.
Wow. Okay.
And where does it stop? It stops at the Alaska-Canada border and the USA-Canada border. Why? Because we as doctors are not diagnosing. I accuse my profession of a misdiagnosis and calling many cases of Lyme disease MS. And also not only that, chronic fatigue syndrome, ALS, Parkinsonism, mental disease, arthritis. We call it everything but Lyme disease. And why do we have the highest Lyme in the world? And if you look over here on the next one, why do we have why did it stop at the border?
Yeah, right. Why would it do that? Yeah. I mean, you are a little colder, but they're surviving.
They're surviving.
Yes.
And this whole area is going to become darker and darker.
Okay.
And this was back in 2001, 2002, up to 2010.
Okay.
Every year. Now, if you put the whole thing together, it's all black in here. All black in here.
Wow.
If you put a black in here, and you see specks of it everywhere now. Okay. And each speck represents what?
A reported case.
A serologically reported patient. Okay.
Yeah.
But if it's one tick, there's 3,000 more ticks in that same area.
Okay.
So this whole area now is saturated with ticks carrying the Lyme spirochete, and eventually this is going to be all black, just like here.
Oh my! Wow.
And we have a major pandemic.
Okay. Wow.
We have to be more aware of what's going on.
Yeah.
And this comes from the World Health Organization about positive serological cases in continental Europe, right up to the Arctic Circle. And here in Canada, again, at the Alaska border and at the 49th parallel, separating Canada from the States. Here in BC, I was treating a lot with people outside of our Canada, and there's 6 doctors here were treating. They're no longer treating. They have no longer have presence, or they have been threatened.
Wow.
Oh my gosh.
Oh my gosh. That's just wow.
But we're not the only ones. I had a Dr. Ross who practiced here.
Okay.
He was given a letter, and he won't be practicing any Lyme disease next month. He told me.
No.
Do you have any clue as to why this
why are they doing that?
persecution of Lyme literate doctors?
I don't know. I really don't know. The evidence is there. I've shown them over and over again. When I showed them this other map of this, they said, "Oh, yes, of course. Don't go to the States or Germany to get your blood tests done. Those are all false positives.
Oh my gosh.
Don't waste your money." Yeah, he called it a money grab. I have doctors infectious disease doctors saying it's all a money grab. Don't go to the States. You're wasting your money.
God, that's
Go by
disturbing.
the Canadian regulation. ELISA test is an absolute answer to Lyme disease, and I call it a BS myself.
Wow.
I'm not Trump, but I call it.
That's good. It just seems like almost. I mean, if you were a conspiracy theorist, you'd think our governments are trying to hide something. Why? What?
I don't.
It just doesn't make any sense to me.
It does not make sense.
Rather than
How can you look at this map of these ears and it's going black?
Yeah, and people are suffering. I mean, this is a disturbing thing. Is it?
The commonest cause of death is suicide, because they see up to 20, 30 doctors saying there's absolutely nothing wrong with you.
Oh gosh.
Except that you're mental. You got too many things wrong with you. It can only be explained by one thing.
Right.
A mental case.
Oh
You're a mental case. Go and see a psychiatrist. And many of the people that I consult with and give free advice to are on antidepressants, tricyclics, and
oh my gosh.
SSRIs and SNRIs. They're just covered with all sorts of antidepressants and narcotics. Fentanyl patches and morphine long-acting agents.
And none of that's going to create health and wellness for them.
No,
it's going to restore them.
No. So I have been, as you are aware, I have been directing a lot of the patients with Lyme disease just for the subjective relief of pain and suffering. Okay, not realizing when I first started that it was giving a relief of an antibiotic effect. But when, some people said, Dr. Murakami, after I've been on it for 3 years, I have no more Lyme disease symptoms. That's when I found Dr. Sappi.
Okay.
Oh, this is
She
okay. This is when
This
you're
is
talking
the
about the
CBD.
cannabidiol.
Yeah.
Yeah. Okay.
Yeah, she confirmed it for me that the cannabidiol from hemp killed the spirochete, now the biofilm, now we're working on the eggs. And I'm hoping eventually this will become the answer. I'm hopefully, too, that there's a vaccine being produced in Europe, which is initially showing good results. But there was a vaccine that came out about, 15 years ago, 10 years ago.
Yes, I remember hearing about that.
Limerix, and they brought me a whole bunch of samples, and I said, how are you preparing it? They said, we'd either ultrasound it, heat it, dry it, or detoxify it with chemicals. I said, if you do that, you're going to cause an autoimmune reaction in the human body. I don't want anything to do with that. I turned them down.
Yeah.
And yet, what happened? An autoimmune reaction has occurred, causing severe arthritis in many people.
Wow.
And now it's been taken off the market.
Okay.
But the one in Europe, so far, they said it's been successful, and that may be the answer.
And then I bet once they get that vaccination, I mean, this is just my thought, is that then all of a sudden all these Lyme cases will be oh yes, it was Lyme all along,
Once you
because
have a profitable treatment.
because
No,
you
I
have
know.
a treatment that will actually be effective. It just saddens me that it goes so unrecognized.
That's we've talked with Dr. Jane Nielsen, who's a Lyme literate MD, he's talked a lot about the conflict of interest in the medical profession. That can be a lot of what drives sometimes what seems like not patient-centered, or where patient outcome isn't the primary motivation, but profit motive for big pharma. What is this image you're showing us now?
This is a cluster of ticks
Oh my gosh.
who are
What?
who are
Ew.
on a that's on a branch, and this is near the Alaska.
This beautiful flower is not a flower?
Oh.
It's not a flower; it's a branch. It's a single branch
Oh gosh.
with we estimated about 15,000 ticks on that.
That looks like a National
moose-
Geographic symbol in the bottom right corner.
Yeah, oh, that's
A
gross.
moose came by,
Oh
and all those ticks embodied itself onto the tick.
no.
In Grand Prairie, there were some ticks found on a moose that was staggering, and it was coming into civilization. And it's not looking for food; it's looking for help,
Right.
because it was totally blistered with these ticks.
Oh.
And if you think about it, 1 to 2 cc's of blood taken by these 1,000 ticks, that's a liter of blood.
Yeah, that's huge. Yeah.
These ticks are being exsanguinated by the ticks. And the specialists say, oh, look, those are just animal ticks. It won't affect human beings. But in Alberta, they found that ticks taken off animals, wild and domestic, 10% or 20% of them were Ixodes pacificum, which are carriers of Lyme disease.
Okay.
In other words, in this cluster, if there's 15,000, a good 30,000 could be from the
Or 3,000 out of 15? Yeah, okay.
3,000 or 15,000 could be from Ixodes pacificum, which is a carrier of Lyme disease in British Columbia and Alberta. Out east, it's in scapularis primarily, but in British Columbia, it's primarily Ixodes pacificum.
Okay.
So this is what's happening in our society.
Why are
moose
so?
population-
I was going to ask, why are the ticks being so prolific? I mean,
because of the warming effect of the world.
Okay.
Before, with temperatures in Canada being so low, sub-zero weather for maybe 2 or 3 months,
it would keep them at bay.
they kill all the ticks, and now it's the other way around.
Okay.
Very few are dying, and most of them are surviving, and that's the difference.
Wow. Okay.
And the deer mice, our population is growing up like mad. And then that combination creates a disaster situation. And the moose population in North America is down 50% in all of North America.
Wow.
It's hard you look up the moose population in the computer and look up moose and ticks, and you're going to be just shocked at what's happening.
Wow.
What's happening to the moose, what's happening to probably other animals as well.
Right. Yeah, I would assume that ticks don't care what animal they get on. They just,
This is a Ixodes pacificum tick, a single female. This
Ew.
5,000 eggs
Ew.
in this one single tick.
That's just gross.
In 2 years' time, half of those would be 2,500 females will lay 3,000 eggs average.
Oh my gosh.
You're looking at millions of eggs.
Yes.
And then another 2 years, that same cluster of females, counting millions, are going into billions.
Wow.
This is happening in our forests right now, up to the Arctic Circle. And we got to get the doctors aware of what's happening. You got to learn. Now, how I got involved with CBD is I developed the brain tumor. You can see it here.
Yes.
This was your brain tumor.
This is my brain tumor, and it narrowed down.